Hey everyone, this is Dr. Tom Sellers from Sellers Sports Medicine and Family Practice. I got an interesting case today. This is an injection of PRP into a patellar tendon. This patient has chronic tendinopathy or wear and tear of that patellar tendon, and they also have a lot of enthesopathy or enthesophytes. These are bone spurs at tendon-bone interfaces. Enthesophytes are caused by repetitive stress, chronic inflammation of that tendon where it attaches or originates on the bone. That chronic wear and tear, that chronic pull can cause some spurring of the bone. Once you have that chronic inflammation and that bone spurring, it's very hard to have a normal healing process. Our hopes with platelet-rich plasma, PRP, is that we can go in there and get a better microenvironment to decrease pain and increase function in that region. Here we see a picture of the patellar tendon in long axis, and we see some evidence of enthesopathy or chronic bone spurring at that proximal patellar area. That's the origin of that patellar tendon, and in particular, that's the inferior patellar pole. And so this is an area where enthesophytes can manifest and can be created. Here is another view in short axis of the patellar tendon, and we see there's definitely some cortical irregularities and step-offs that show that that is not a fracture of the bone, but in fact enthesopathy or that chronic spurring of the bone. Now let's jump into a video of the actual injection. So here we see the patellar tendon in short axis, and we see some of the enthesopathy or those cortical changes of that inferior pole of the patella. It just looks lumpy, bumpy, looks abnormal, and we see that the tendon integrity doesn't look good in this area as well. So in terms of the injection, we're seeing the needle coming and injecting PRP and also fenestrating or doing some percutaneous tenotomy, so needle passes in this region. Of note, when we're doing this injection, because it's right on the inferior pole of that patella, I do a little bit of an oblique angle at that so I can get a little bit better runway and a little bit better needle visualization in that region. This patient has now gotten a better microenvironment with this PRP. We're going to hopefully have a long-term anti-inflammatory effect from this as well. And we have plans to do extracorporeal shockwave therapy into this region to help break up those calcium deposits and further stimulate blood flow into this area.